Okay, so to start off, what do I have to do? So here's a statement. If you can look at that. First of all, I want you to all raise your hands. Can you do that? Raise your hands up. Okay, thank you. Now, this is a little complicated, I've been told, so you have to pay attention. If I get it wrong and mess it up, I'll try to explain to you what I'm trying to do, okay? So raise your hands up and think about the children in your life. Your own children, your grandchildren, students, and so on. At any point in their life, how would you hope that they would answer or address this question? If you would want them to answer 1, 2, or 3 disagree, you can put your hands down. Okay, now look around the room. What do you see? Okay? And this is a pretty much, and you can put your hands down. This is pretty much a universal aspiration we have for our kids. Here's one question. How well are you doing? And really what we want the kids to answer is, I agree with that. Now when I ask educators this, 90% of them will say, they hope they would say moderately or strongly agree. But here's the problem, is that although this is valued and agreed, there are a few schools that are monitoring students' social emotional health. So how do we help children get to strongly agree? And that's what our project, Covitality, is about. Since 2010, Project Covitality has been our effort at the GGSE to contribute to schools' efforts to foster students' social emotional wellness. One aspect of this project is to develop measures that schools can use to efficiently monitor students' progress towards thriving well-being. This project is truly locally grown. It all started in 2007, 2013 with 2 federally funded Safe School Healthy Student projects, one in Carpinteria and the other in Santa Maria. The educators who worked on those projects raised this question to us. Can we ask our students about their hopes and aspirations and not just about their risk behaviors? There emerged an interest to know more about the students' positive development, more about who they were becoming as human beings. A first step to getting to strongly agree is to recognize that monitoring students' social emotional health is just as important as monitoring vision and hearing. We have universal ways to assess vision and hearing, but honestly, we have done a lousy job of assessing students' psychological well-being. And is there more on this slide? No. Next slide. That's it. They have 2 slides here, so you get confused, right? So here's, in the past 7 years, Project Covitality has developed several measures. For example, the Social Emotional Health Survey's secondary version. Briefly, the secondary version asks students in grades 7 to 12 to comment on key social and emotional mindsets that they are developing. The questions are designed to address 2 basic questions, one of which Rebecca raised. Belief in myself. Can I trust myself? Can I trust others? Belief in others. In addition, students comment on core emotional competence skills such as empathy, emotion regulation, self-control, and their engagement, gratitude, zest, optimism. These adolescence traits are associated with positive well-being. So Covitality has another core idea. That is gratitude, optimism, etc., and so on, have individual benefits, but their full value is realized in combination. Simply, the sum is greater than the parts. There are many great examples of how a combination of ingredients can have enhanced benefits, and one of my favorite is freshly baked bread. Yummy, okay? If you were so inclined to eat flour and water right there, and that's how you did it, you would not only thrive, you would perish. However, when you mix water and flour together, you get what? Nutrition. Naturally leavened bread raised by the action of wild yeast spores drawn into the dough from the air. When it's correctly fermented, it releases 18 amino acids, complex carbohydrates, B vitamins, iron, etc. In the baking process, bran is broken down, releasing nutrients into the dough so they can be absorbed by the human body. Otherwise, you wouldn't get that nutrition. Another way to think about Covitality is that its parts provide the structure on which well-being is supported, as in this building here. Covitality offers one way to get to strongly agree. Sounds interesting, maybe, I hope, intriguing, but does it have Covitality matter? So working with our partner schools, we have now collected Covitality surveys from more than 50,000 students. And here are some of what we're finding. Back to the original question. So students who have high co-vitality report that 90% of them addressed the question, my life is going well, moderately or strongly improved. And you can see that's 9 times higher than students have low co-vitality. The students are 10 times more likely to report that they feel safe in school. They're 4 times more likely to say they feel happy to attend the school that they go to. And they're twice as likely to report that they're getting A and B grades in their classes. So it looks like it makes a difference. Of course, an important value of any measure is how it's used and if it promotes good. So one way that co-vitality has been used with our partner schools, they set up student care coordination teams that administer the surveys to all students with parent consent, student assent, and the care team members use this information to plan school-wide strategies to boost students' co-vitality, and they follow up with specific students who might be low in co-vitality to help and support them. Locally, we've been collaborating, for example, with San Marcos High School for the past 5 years. We are also excited by many expanded opportunities that we hope will support efforts to expand school-based mental health and wellness services, both practically and applied in specific schools, and via influencing educational policy. For example, in December they did the biennial Santa Barbara Healthy Kids Survey, and there for the first time we were able to incorporate co-vitality questions so that we have information about all the students in Santa Barbara County, and we'll be developing reports in the coming months. Via some federal funding project that we have with Student Education Sciences, we will in the next 3 years be doing a longitudinal study to follow the students throughout high school to see how does their co-vitality, what are their trajectories during the high school years and how that's related to positive educational and life outcomes. In the next 2 years with the California Department of Education and WestEd, we're going to be surveying over 100,000 students in California. And for the first time, I think we're going to have an awesome data set that really informs us about the mental health and social emotional health of students in California. And also, we don't leave everybody out. We have a primary school version, and we actually have developed one with undergraduate students at UCSB that we're actually using at UCSB that follows sort of the same idea. So it started as a Carpinteria Hope Survey in 2009, is now being enriched by colleagues and educators worldwide. And we're exploring the potential contributions of co-vitality in other cultural contexts. It seems that getting to strongly agree has broad interest. So I always keep in mind what Matt Quirk, GGSE faculty, told me. He said that professors often start a talk or presentation without a clear exit strategy. So here's my strategy. So I do want to thank Aaron Dowdy and Karen Nyland Gibson, my colleagues who've been working with this, and all of our graduate students. It's a real team effort. I also want to just briefly thank the Santa Barbara community. I've been here for over 40 years, and all of our work has been so greatly supported by parents, teachers, and the community, the educators in the community. We couldn't do all this without the partnership with you all. And if you want more information, you can Google Project-Covitality. Thank you very much.